Welcome everyone, whoever is here and whoever's watching on YouTube or wherever, to the sixth year semester guidelines. I'm Pranav. I have Sandra and I have Dr. Ines with me, who is who is substituting for Agatha today. But glad to have you on. Thank you for taking the time.
Thank
Um,
you.
and we can get started. We're going to just run through all the subjects and how to study for them, what you need to know, etc. So next slide.
So first of all, I think it's very important for us to know what are the main subjects and the main state exams that we will have. So we will have surgery, internal medicine, gynecology, pediatrics, and public health. As many of you have realized already, gynecology, the practices start in fifth year, and you will just take the state exam on sixth year. Okay, Sandra, you can move to the next slide, please. Yes. So regarding public health, the exam format is going to be an oral exam. So it's going to be like, in a way, like a normal block exam. And the main materials that personally I used was DASIS document, and I mix it with Florian's. So whatever Florian added, I would just mix and like with DASIS documents. Regarding the lectures, I'm going to be honest, I didn't use that much. I used mainly for the disinfections. I used for the hand disinfection, which I think is super important. They ask a lot. That's the main focus. I think overall, the exam, I don't think the teachers expect you to know a lot of details, but they do expect you to know very well the part of disinfection. I think there is on Google Drive some lectures regarding the hand disinfection made by the teachers, and I think those ones specifically are very important. Of course, if you have time to go through all the lectures to see if there is any missing information from the other documents, that's also a good idea. But I think the main points, I think Daisy's and Florian's document are a very good document by themselves, and I think you can totally pass it with that information that you have there. As I said in the study tips, yes, I agree with the hand disinfection, hand washing. That's going to be the basics that they will ask you. And they changed it, I think, in my semester to a mandatory questions. Before it wasn't, and now they changed it because there were many people that they were not that prepared. I highlight again, go through the lectures of the disinfection because they have all the questions that they ask you in the exam there. I find it very hard to know the answers that they ask you without going through those lectures. Okay, next one, please. Okay, regarding the gynecology.
Can I add one thing to public health, just in terms of resources?
Yes.
So there is also this book. I have it here. It's this Community Public Health in Policy and Practice by Sarah Cowley, Karen Whittaker. Really good book. And the classic book, Bonita Pickleho. This one is also very useful. The document is fantastic, but like, it can say a lot without actually saying anything.
Yes, I actually forgot to add that when I was studying from the documents, I cut a lot of information.
Mm-hmm.
So don't, if you are studying from those documents, don't feel overwhelmed from it because they have a lot of information that it's not important, and it's very important for you. That's why public health, I think the hardest part is the first approach to the subject because it's so overwhelming. It has a lot of information, and it's very hard to know how to filter it because it's a subject that we are not really used to study in a way. Like in gynecology, we kind of can feel what is important, what it's not, and here it's different. So yeah, I totally agree with Pranav. Yeah.
One last thing is that when you do your exam, just keep in mind that you will all be preparing in the same room, and then you're going to be taken into different parts, like by different examiners. So it's not like you go to one doctor and then you just doing the exam with him. It's like you're going one, you come back, prepare another question, prepare, vice versa. So just keep that in mind.
Yes, I don't know how it's, well, it's going to depend this year, right? With the pandemic situation, I don't know how it's going to work. But when I did it myself, I did it online examination, and it was, in case it happens that people start doing again Microsoft Teams exams, they will have all the examiners on the Microsoft Teams, and each of them will examine you independently. The good thing about it is that everyone respects that if you're going through the first question, the only examiner for the first question will just ask you those extra questions. The guy from law will ask you the questions for law, and they won't like interrupt you at all. So, but yeah, that's it. Okay, so regarding gynecology and obstetrics, as I said before, I did the pandemic, the exam during the pandemic, so it might be slightly different, but not that much. The only thing that I didn't went through was robot part. I heard that it's quite reasonable. It's not a difficult robot examination. It's not. The part of the practical, it was identical to the Microsoft Teams, so it means that you'll take I think it was 2 questions, if I'm not mistaken, and you will just not have any time to prepare. That's the tricky part, I believe. But you studied it like you study for the other exams of the oral. So it kind of looks like a continuation of your oral exam. It doesn't look like you don't have to show any specific techniques in the practical part. It's just kind of a theoretic part. I'm going to give the example. For example, I had ultrasound in the practical part, and I was just talking about it like it was a normal question, and yeah, I just didn't have any time to prepare, but that was it. Regarding the materials, I didn't have the Daniela's document in my semester yet, so I cannot give any opinion. Maybe Pranav or Sandra or any other students that are now going through 6th year can help you more with that. But I did.
Sorry, I can add for Daniela's document. Basically, it's based on notes from Gyne's department, but those notes are written in Czech. So Daniela basically translated those notes into English. So those are basically the stuff we have to know for each question.
That's great, because that means that they are based on the website, right? The link that they give you from. Yes, I was going to talk about that. So unfortunately, I only discovered that website quite close to my exam, but it was actually life-saving, because I got a question that I studied only from that website. I translated everything myself, like with Google Translate, etc. And everything they asked me, which was oral contraception, everything was in the website. So how they structured everything. So if you could base your like all the questions you can from the website, it would be great. I think that would be major help. Unfortunately, I didn't have enough time to go through it properly, but it did help me, and it was life-saving. I love the Herring's document, and Maria's document is very good for you to organize, because I believe they changed recently the questions. The order is different from Eric's, I think, and Maria's document is very good for you to organize yourself with the questions. Eric's document in terms of information is great as well. So a combination of these 3 for me would be perfect. If Daniela's, as Sandra said, if Daniela's is just a translation from the website, then it's great, it's perfect. And I did watch a lot of osmosis videos as well. The other websites that they give, I think, might be useful. Personally, I didn't use Kaplan, for example, or other sources on YouTube, only osmosis. I don't know if anyone has done gynecology yet, but that's mainly what I use was the books that you show here, and it's more than enough, I can guarantee you.
I'll add just one thing. Basically, so when we did our Google Forms, we got some input that whenever you do your practice, it's good to ask the professors what is actually important, because gynae is a very huge subject, and the professors with gynae are really helpful in terms of letting you tell you what to focus on and what to focus on. So it can save you some time if you just ask them directly. Is that
I just wanted to add something that I forgot. Might help someone, I'm not sure. For example, in my practical part, I had ultrasound, and I would just recommend you, if anyone has this question on the exam, to go a bit deeper on the information here. They are not hard examiners at all, but I did find that they were very into ultrasound. I believe that it's because it's such a routine examination that they do every day. They are they know a lot, and they are very into the proper differences that you can see from month to month. So if you can go a bit deeper on that part, on the ultrasound, it would be perfect. They are, as I said before, they are not unfair examiners at all by any means. I'm just saying that the question might be a bit more demanding in terms of information.
Okay. Do you want to go to the next one?
Yes, please. Okay, internal medicine. This one is a big one. So this one, it's an oral examination, as many people know. The books and materials are very diverse, very diverse. Personally, the main information or the main material that I would use would be actually taking notes from the classes. If you have anyone that is taking internal medicine classes in Brno, because I know that many people in 6th year, they just go back home to do the practices. If you actually are staying in Brno, it's so important to take notes. I used some notes I can share eventually. They are written notes. I can scan it and share with MIMSA as well. There's absolutely no problem. But those notes are based exactly on that, on the information that the teachers give you during the classes. Especially hemato-oncology. Hemato-oncology, they give you a lot of information, and as many people might already know, hemato-oncology is the hardest part. They really expect you to know a bit more. Some people are super afraid of the state exam. I want to reassure everyone that it's not as bad as it looks, but they really do ask a lot. It's a tiring exam, but it's not at all as bad as it looks like. Besides that, and I highlight, it's very important to take notes from classes. Ask your colleagues that are currently doing the practices in Brno Hospital, because it will help you a lot, and that's mainly what they ask. Boss, it's amazing as well. I really liked it. It's exactly how they ask you. They want you to structure it. They want you, for example, to start with the definition of the disease, symptomatology, how do you diagnose. So go very structurized, make sure you organize it properly. They will give you time to prepare. They will ask you a lot of questions, but if you don't know it immediately, it's already it's going to be fun as well. They will just ask you some extra questions and try to guide you for the correct answer. I think the questions, they don't come as a way to stress you. It's more just to see if you actually know some fun facts, and it's not as bad as it looks. So yeah, I did use a lot of AMBOs and the Oxford Clinical Medicine for internal medicine. It's also very good. As I said before, one of the most important things is to know how to structure and organize your question in this exam. They don't like that you go and present your questions and present it in an organized way. If you are consistent and methodic presenting your question, I think the result will be successful. I don't know if anyone wants to add anything. I see that Paul Baldwin is appearing a lot in YouTube, but I personally didn't use it. I just used mainly osmosis and Ambos.
Hi, Ines. I have a question, but this is not regarding internal. This is regarding gynecology. I just couldn't add it then. I hope it's okay if I ask it
No,
now.
it's okay. It's okay.
So about like, your practical part, you said you had ultrasound. So you told me like, okay, they don't want to just talk about superficial things, like a little bit deeper than the usual. So is it like more like the practical sense, or is it more like knowing about the biophysics part of it?
No. They really don't want you to go for the biophysics part.
Okay, because when you said deeper, I was like, no, not biophysics.
No. Maybe I said myself wrong. So when I meant that is, for example, I might be mistaken because I did my exam a couple of months ago, so I don't remember exactly the questions, but I believe that one of them was regarding the nose formation because of the in Down syndrome, they have translucency, nuchal translucency, nose formation, and that's a way that you can diagnose it, right? And they were very into whether it was really in the third week, if we could already see it or not. It was more about which organs and which structures can you really see it in each month. You understand what I mean?
Okay,
It's
yeah,
more
I get. So it's important for us to know which organ or what development can be seen every week in
the
the.
nuchal translucency, as I said before, please check it again. But for example, I thought that the nuchal translucency you can see a bit further on as well, like second month, and I think it was not. And they were very into it, So
Right. So it's more important to know those details.
yeah, exactly. So don't memorize my answers at all because I generally don't remember the correct answer. But what I'm trying to say is, for example, when you study, you'll for sure see nuchal translucency, nose formation, etc. Make sure that you studied it further. Go search it on Google, and Boss maybe even has it, and see exactly when the structures start to appear and when you cannot see it anymore. Because, for example, nuchal translucency comes to a point that the head is already formed, so you cannot see the translucency anymore. And that's what they meant. I don't know if this helped.
Yeah, no, I understand. I was just concerned, like, is it more like the
No, they
gynecology
don't
part, or is it
have
more like biophysics part? But
no,
thank
at
you so
all.
much.
At all. You really don't need to study at all. I think I didn't even talk about it. I just talked about what can you see. So
Thank you so much.
no, don't worry.
Ines, I have a question.
Sorry. Just wanted to add because I have like gynae in like, I don't know, give or take 1 month. So just wanted to ask, how long would you prepare for gynae?
I think gynecology is quite I wouldn't say easy, but it's not as demanding as internal medicine or surgery, for example. So I tend to relate gynecology to a normal block in fourth year, in my opinion. I don't think it's quite. They are only 3 examiners, and personally, I would in 2 weeks you can be super prepared for it, in my opinion. Especially studying from the website, as I said, the website helps you a lot. Maybe I shouldn't be saying this here, or I don't know, but there was the question that I got was oral contraceptives, right? And I only studied it the night before my exam, and I studied it from the website. And when I went, I got exactly that question, and I only knew the information from the website, right? That Money provides, and surprisingly, that was it. They didn't want more, and the answers, the questions that they asked me, I only knew because of the website. I don't think I would know it by any other means. That's why I'm really highlighting the website. So I think 2 weeks, it's more than enough. Unfortunately, they canceled my exam date back then, and I only had 5 days, so it was very stressful. I don't recommend that, but it was still kind of doable to do it in those 5 days, but it was very exhausting. I recommend 2 weeks for you to be relaxed and have time to prepare everything very well.
I'm sorry, you did gynecology in 5 days? Wow, like hats off to you. I'm very impressed.
No, they were canceling all the state dates. That's why I had to do it. I was very stressed. I don't recommend.
Okay. But Ines, I have a question about internal medicine.
Yes.
What do you exactly use? Like, what do you recommend us to
Yes,
use?
as I said, in internal medicine, I even said I can share the notes. I think I have with a friend of mine now, but they are written notes that it was my sister who made it. The boyfriend of my sister, Rodrigo, added some notes as well. So it's a mix of notes from the classes that all of them were going to the classes in Borronite. So just use that. They are handwritten. I don't mind at all sharing them. They are very useful and they say exactly what it was said in class. And besides that, I did ambos, but I used mainly, to be honest, I used mainly those handwritten notes. Internal medicine for me, it was the hardest because some questions are a bit specific that they ask. So if you want, I can ask my friend and she will scan it, the notes.
That would be great.
Yes, I don't know when do you guys plan to have it, but I think internal medicine, I would take. I think 2 months is the best best timing to do it. Like 2 months. As I said, I always make it a bit more to make sure that everything is consolidated. Some people do it in 1 month, for example. I don't think 1 month is critical at all, but I think for you to actually have time to process it is a lot. You're going to be stressed. Hemato-oncology is very demanding. In hemato-oncology, if you go to the teachers, they will give you exactly what questions does Professor Tomiska, which is the one examining that part, asks in the exam. So that's very, very helpful.
Okay. That's good.
I will just add something very quick for internal. So when you're studying for internal, a lot of alumni members have said that, and even Ines, as you said, focus on the basics. So if you're focusing on the pathology, so if you do pathoma again, and if you do the basics of physio again, that's 100% going to help you answer those simple questions that get asked.
Also, don't feel stressed. Some people sometimes tell you about their experiences that they ask very weird questions. They did that in my exam as well. But I think what people sometimes don't understand is that those questions are not for grades. Sometimes they generally just to like, haha, like, do you know this? And I tricked you there, They really take it in that way, honestly. So they will ask you the weirdest questions ever, but they don't count for anything. It's just kind of, as I said, it really works as a fun fact. Of course, they will go through the basics as well. So as you said, I went through a bit of, I don't know if you remember the BRS for physiology.
Mm-hmm.
I think it's Constanzo. I don't know. I don't remember exactly, but it's a small book. I went through it. I think it was for pneumology, and the pneumology teacher is amazing. He's very nice, by the way. And cardiology, I think it's very helpful. Besides that, I didn't use it that much, but it's go for if you know the basics, they will for sure pass you.
Also, Ines, I got so someone asked me a question. So they basically asked if 60% of peds is internal medicine.
Yes.
Okay, so you should do internal medicine before peds.
It will help you a lot. It will help you a lot. Yes. If you prefer doing peds before, then do it. But it helped me so much. It was basically the same. Besides the breastfeeding part, dehydration, that it's very. I will go through it in pediatrics. But yes.
Okay.
And I think one main point here, maybe it's too early to say this, but when I know it sounds a bit, maybe it's not the best tip ever, but I find it very important for me. When you finish all your state exams, you'll be very tired, and that happened to me. So I would recommend you to actually try to do as much of the hardest states before and finish with one of the easiest or one of the ones that you think will be easier for you, you know. So for example, I try to do internal medicine and surgery as soon as possible, and I left pediatrics, for example, for the end, because pediatrics is the one that I want to become a pediatrician. So back then I was so tired, but because I was actually studying something that I enjoy studying and the exam itself is not demanding, it's it's more important than people think. And many people actually that did the opposite finished with the hardest ones. They had to delay it because they were so mentally burnt that they couldn't study. It's a lot of exams, you're going to have a lot of practices, it's stressful, it's your final year. So please try to organize it. Of course we cannot not always organize it that way, but if you can, really try to finish with a less demanding one. Like, don't finish with internal medicine or surgery. If you can, just try to finish with, I would personally either finish with gynae or pediatrics. Public health is just because it's not my thing, but it's also a good idea to finish with public health. But yeah, I
Okay.
just wanted to add that. Sorry.
Should I go to the next one?
Yes, please. Surgery. So surgery, yes. So you have the practical part. As I said before, I did the pandemics exam format, but I kind of know how it works. So if in case anyone here has to do it in the Microsoft Teams, you'll have to do a case report, kind of like take the anamnesis or choose like anamnesis from the practice. From the practical part. So the age of the patient, etc., nothing much. And you'll have some instruments. It's exactly the same. In the practical exam, in the personal format, so in person to person, they will ask you to actually ask in check some questions to a patient. It's basically the same thing, and that's it. That's basically it. It's like a normal class back in fourth year. I think it's, you just have to go to the patient, ask some questions, and say whatever you know about the patient to the teacher. I know many cases that they were not able to understand it properly, and they were completely fine with it. And they will most likely ask you like a quick question. For example, I know one case that it was diverticulitis, and they just ask you like, what is diverticulitis, and that's pretty much it. So the practical part, I don't think it's going to be that hard. Also, you have the imaging methods, and those ones, I think you have to talk with your colleagues, because usually you have a PowerPoint, I think, that you have all the possible or probable imaging methods that you will see. For example, you have an image of the stones in the gallbladder. They have a PowerPoint on surgery, but it happened to a couple of people that the images that they were showing, they were not on the PowerPoint. So just, these are the little things that you really need. It's very beneficial if you talk with your colleagues, ask what happened in their exam, if they had the same imaging methods or not. For me, it was more than fine. I don't think it was hard. I had actually the gallbladder stones, but many of my friends, they didn't have it. So maybe it was because we were doing it online as well. They have a lot of images, so might be because of that. Regarding the materials, so actually I don't think it's added here. I personally used some handwritten notes that are in MIMSA Study Hub, and I used mainly those ones. I printed them, and I used emboss. I can see as well that in the study tips, you add the AO classification of the fractures. This is very important. They asked me a lot about this. I want to also recommend something in surgery. So basically, you have to choose 3 questions, if I'm not mistaken, and you can take 5, 6 questions. I'm not sure. I'm not sure actually. But yeah, you can pick 3 questions, right? Most likely you can only choose one of them. So the first ones are going to be A and B, and most likely they will tell you, look, you have to prepare these ones. You can choose the 3rd question, and that's what's going to happen. What I recommend is to not pick neurosurgery at all. That's my recommendation. It's very demanding, the exam. Even if it's an easy question, it's very demanding. Try to avoid that. For example, pediatrics, it's quite a good option to go for. It's not very hard, and you don't have any specific teacher that is specialized on that area usually examining. So it's going to be a good option. I think on my day, almost all of us had neurosurgery, and it was the part that all of us agreed that it was very hard. So try to kind of choose another question if you can, if possible. Besides that, yes, osmosis is very important as well. I think it helps a lot. But I think in surgery, AMBOS and the handwritten notes that are in MIMSA Study Hub, they are very good, and that's more than fine. The only problem with this exam, I would say, is a neurosurgery that if you have, it might be a bit harder, in my opinion.
Can I ask, how long did you spend on surgery, to study for surgery?
For surgery, I think I spent a bit of time for surgery. I think I spent 2 months, because it was my first state exam as well. So I was very nervous, and it's a very big exam. But something that you'll see, and I'm not sure if they changed the questions already. They told us that they would change, because the questions are super big and they repeat themselves a lot. So don't feel so overwhelmed when you start checking the questions, because most likely you will repeat it. You will do cholecystitis, but then you'll have a question further on saying like gallbladder problems, that you'll have to talk about cholecystitis as well. So, it kind of repeats itself. The pediatrics part repeats itself in the trauma part. So it will, I think, 1.5 to 2 months, both surgery and internal. I would say 1.5 to 2 months to study it properly. Yeah. Okay.
I can just add something for surgery. Oxford Handbook we've already mentioned, but it's a very good resource if you want to get like just a good overview of the surgery itself. And then there's a website which we didn't mention here, but it's called MSD Manuals, or I think it's MSD Manuals. So just check that out. A textbook that could be useful is Sabiston. Apparently, a lot of people use that. So if you guys wouldn't want to use it, then that's there. But just wanted to add that.
Okay.
Okay, and pediatrics. The practical part, I really can't help much with that, because I didn't have the practical part on my day. I believe that it's not, if it's a case report, it should be more than fine. They are one of the nicest examiners, in my opinion. Regarding the how to study for pediatrics, I used mainly Kaplan, which is one of the best books to study it, and the Oxford Book of Pediatrics. I actually purchased this Oxford book specifically to study for this exam. They are both very good. The questions, actually, they said themselves that the questions that they made for the state exam, they are based on the Oxford Book of Pediatrics. So if you can borrow it from someone or download it by any means on Google, it would be super helpful for you. They won't ask you much more than that. Something that I want to highlight when you take this exam is they are quite nice examiners, but they really pay attention to the dehydration. And why? Because dehydration is one of the main causes of death in babies. And it's, for example, everything that it's related to diarrheas, dehydrations, fluid therapies, etc. In Kaplan, they have, I think it's in Kaplan, they have a specific chapter talking about how to do fluid therapies, and they ask you all of it. So if you have that question, be prepared that they will ask you a lot. Otherwise, they won't ask you much. I had to talk about obesity, and it was super normal questions. They asked me about percentiles, so kind of like easy questions. They just want you to know more or less the overview of pediatrics, and the only questions that they really are into and looking for, it's dehydration. Besides that, as I said before, if you do internal medicine before, it will help you a lot. I took 10 days for pediatrics. As I said before, my year was a bit difficult. It was we had a lot of exams dates canceled, so I had to do it in 10 days. I think 2 weeks it's more than fine, especially if you did internal medicine, because that was one of the main reasons why I was able to do it in 10 days. It was because I already knew the tumors, I already knew the traumas, the fractures, because in surgery you have a block only of pediatrics, for example. So all the fractures that you studied, it's going to repeat itself, and you have to focus on a small part that it's going to be percentiles, cognitive development of the babies, when do they start walking, and so on. So you know already most of the bases of it. It's quite of a nice exam to finish or to start if you're scared of the state exams, and most likely will have a good experience. Of course, everyone has their own experience, but I think it's overall, if you study from Kaplan and Oxford, more than enough. You're probably going to smash the exam with the Oxford book, and yeah, that's pretty much it.
How long would you
Oh,
say
sorry.
for pediatrics?
How long to study?
Yes.
So if you did internal, you can easily, I did it in 10 days and I don't think I needed more. And I'm not a person that likes to study with stress. I can't deal with that, but I did internal medicine before, and in 10 days, I didn't have that feeling that, oh my God, I still need to study more. For example, in gynecology, I felt that. I felt that 5 days were very, very hard to cram all the information in. But in pediatrics with internal medicine, 10 days, more than enough. If you didn't do internal medicine before, then 2 weeks to maybe 3 weeks, because they are very understanding, they are very nice. That's why I say this. You might get scared with the amount of questions, and it's a lot to study, but they are very nice examiners, and they really just focus more on the dehydration. That's why I'm saying that between 2 weeks and a half, 3 weeks, if you didn't do internal medicine, you'll be more than fine. I don't think you need that much more.
When you said Oxford book, you mean the handbook, right?
Yes, it's
The small book.
it's a blue. It's blue.
Yeah, it's a blue small little book, right? It kind of
Yes,
looks
yes.
like the other handbooks.
Yes, exactly. It's the one for pediatrics, and they really told us. And if you look at the questions, you'll realize that the chapters actually go through the questions. Like, it just kind of repeats itself. Of course, there's a couple of them that maybe it's not exactly how it is, but it's the way they did the state was based on the Oxford book, and they said that themselves. Also, I'm not sure um, if MIMSA has access to it or not. Um, but I think maybe the lectures will be helpful as well, especially the dehydration. I don't know if anyone had access to them. or not. I didn't, but that would be helpful because I think they actually have a very nice PowerPoints back then. So if anyone has anyone who maybe the ones from 5th year, it will be helpful for you to just go have a quick check on that, because I remember those lectures were very good, and it was very unfortunate that any of us got access to that back then. So that's the only extra tip that I would give. Besides that, I think, as I said, just to recap a bit, I would study internal and surgery in 2 months, more or less, 1.5 months. Of course, if you're not in a hurry, right? Then then gynae, pediatrics, 2 weeks, and public health. Personally, this depends as well on the person, right? But I didn't like the subject at all, and it was so hard for me to focus. So I usually recommend 3 weeks because I couldn't. That's personally how I would organize myself. So focus more on the big ones, internal and surgery. Once you graduate, those are the ones that they will look for as well. The other ones are more specialized exams. So usually when they check, if they check, it's going to be more for the surgery and internal, which is the big one. So try to actually get good grades on those ones, and yeah, and don't get scared with the state exams. It's just scary when you have all of those teachers in front of you, maybe, but in the end, it's not as bad as it looks at all. And yeah, that's pretty much it. I hope it helped someone. If you have any further questions, you can ask MIMSA, or you can just send me a message, and I will try to help as much as possible. Any notes, etc., just text me, and I will try to send to you or to MIMSA.
I just wanted to add something. This is what I heard about pediatrics practical, because Ines didn't really mention it because she didn't have it. But this is what I heard from the doctors in Gynecology, because they are like, it says case report, but apparently they want like a step-by-step anamnesa of everything. So they really expect you to have a proper case report, in the sense that, so it's not like surgery where they're pretty chill, because I've heard in surgery it's like, even if you get like 5 sentences from the patient, it's fine, it doesn't matter. It's really fine. But in pediatrics, this is what I've heard. Of course, we can confirm it from anyone who has done pediatrics this semester, but I've heard that they are pretty, I don't know if I can use the word strict, but they really expect like a proper case report, like those pages we get from the doctors to read about the patient. It's something like that they expect from us, but in English, of course. I mean, or we can write it in Czech, but I know our Czech is not that great, so we would write it down in English.
As I said, that's one I really can't help, because they didn't have any type of practical part on the Microsoft Teams. I didn't have to present anything regarding the practical part. The surgery one, it's very easy. It's very easy in terms of, like, sometimes if you get an older patient, most likely you won't be able to understand much, and they will probably give you the anamnesis. Many teachers just give you the anamnesis and you just translate it, and they will just ask you a bit more information. If, for example, if your patient suffers from kidney stones, he'll ask you just 1 or 2 questions about kidney stones, and that's it. Pediatrics, that's the thing, I really don't know. So I would recommend you guys, I don't know if they even had that before, the practical part for pediatrics. I don't know if it existed or if they just,
apparently it was there, but they removed it for the pandemic.
Okay, so I had no idea. All of the people that I know that did pediatrics, I never heard about the practical part. That's why I really can't help.
I was very surprised because I didn't know it was there as well. But Josie told me, because she was interning with this doctor who's Israeli, but now she works in Czech Republic, like in Brno. And she told Josie, like, oh yeah, we have a practical part and you have to do this case report. And I was like, wait, what? And then it's there in our catalog. If you open on IS the catalog for us, it says case report. So I'm guessing that it's the same thing. So
yeah, I would like probably even my sister, I don't remember her talking about it. That's why I'm so unsure of how it works now. Just maybe really try. I don't know if anyone has done pediatrics yet. Even I don't know. Like for us, it was most of us did it like it was our last exam. But I would just really recommend you checking it on that. The only thing I can say is that in terms of examiners, they minds like I think it was one of the best exams I had since fourth year. They were so nice to me. They really don't expect you to know much. I didn't even felt like it was a state exam. They were super friendly. The practical part, as I said, just try to get as much as information because I don't want to like say that it's going to be easy, that you might have a specific doctor, that it's going to be a bit more demanding. So yeah, that's pretty much it from me. I think.
I will just add one, just a final piece of advice. With these exams, since you're in front of a committee and it can get a little intimidating, you have to keep your confidence up because you will be a doctor. They want to see confidence in you when you speak and in the way you prepare your questions. So, very important. Eye contact, body language, everything, especially with internal medicine, apparently. Uh, but this goes for all exams, like even if you're in second year, third year, whatever, this is sometimes what makes the difference between passing and failing. So you have to show them that you're capable of being a doctor, which is the most important thing.
Yes, I think the one that it's going to be the two that are the scariest are the surgery and the internal, because in public health, and I think Pranav and Sandra, probably you guys did it already, I think.
Yeah.
As you said, you go through each department and you are not faced with all of the examiners. I think in Microsoft Teams it was the same. Everyone was examining me independently, and if it wasn't their question, they would mute themselves and they wouldn't listen to me. Surgery and internal, unfortunately, they are the hardest ones to study and the most stressful in terms of exam itself, because it's so many people, and they know, especially internal medicine, they might be from pneumology, but they know cardiology. So don't be surprised if they start asking you. Uh, as Pranav said, I think it's very important that you are confident, that you don't need to be a know-it-all, let's say, but you need to be confident. And if you don't know, I would recommend in internal, actually try to think it out loud, because they sometimes they just really want you to think a bit more about it. I kind of relate it in a way to physiology, when they asked you and they wanted to see how much you knew, and to see if you could, even if you didn't know the answer, if you could get it there or as close as possible. So yeah, and that's pretty much it. Okay.
Amazing, amazing. Thank you, Ines, for taking your time and short notice.
No, thank you
Really,
for having me.
anytime.